is, does this go up on the right side?
Yes.
Yep. So what was my determination for that is that I would like her pelvis to be as quote unquote neutral as possible, like ASIS, almost if I drew a perpendicular plumb line, it would be almost at a PSIS. That's significant because I want there to be as much of a parallel between the pelvic floor and the diaphragm as possible. My caveat and things that I struggle with in life are things that are ambiguous. So when I get a referral diagnosis of dyskinesis, I'm like, damn it. I can't really quantify that, and I don't even know what my success looks like, right? And so that's my caveat. The diaphragmatic breathing was also an area of when I got into school, they were like, all right, so now you're gonna push out and breathe and this, that, and the other. I found it very difficult. I've settled on a technique that I think works. It's a little bit more structured, and I'm gonna try and make what was abstract for me. Maybe you guys already have your own system, a little bit more structured for you. So I start with hands on belly, one hand on chest. Boom. I say a minimum of 30 seconds to a minute. I'm just going to have you breathe and observe what happens. Right? And I'm going to have you close your eyes, right? Because sensory system, visual system is so dominant in our sensory system that I want them to otherwise just be calm and identify how much the belly rises versus their chest. Okay, so they go through that. 30 seconds comes up, and I ask them what they observe. Some people are really intuitive, and they'll be like, oh, I recognize that this one hand moved relative to the other. Others, they really have no idea, and that's fine. Typically, the ratio in a supine position is usually a 1 to 2 or 3. And so once we've gone through the observation, then we can, of what's actually transpiring, then we can work on actually changing it. And so there's a lot of evidence around vagal nerve stimulation, right, and helping to kick people over into more of a parasympathetic dominant state. And so the breathing sequence that I've seen to be most consistent with that is a 4, 7, 8. So that would be 4 seconds in on the inhale, 7-second hold, 8 seconds out. And so now that we have an observation, I inform them of this 1 to 3/1 to 2 ratio. And then, and honestly, Kristen did a wonderful job initially, right? So there was more belly movement relative to chest. And then I'm like, great. Now, Kristen, what I'm going to try and have you do is take control of your breathing. And now your inhale is going to be 1, 1,000, 2, 1,000, 3, 1,000, 4. Hold 7 seconds. And then full exhale 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8. And I just give them just a gentle pressure. I will say the 7 seconds, personally at times, depending on the state that I'm at, can make me a little apprehensive, right? Just the increased breath hold, a little bit of hypoxia, so usually, or hypercapnia, and so I just, depending on how they're doing with it, I will either defer those 7 seconds and just go 4 seconds in, 8 seconds out, and I'll, at the time, orient them to this kind of rib cage depression position. That will also not only help them to relax, but it will also be important later on as a skill set that I'm going to want when I go into their end ranges of motion of their shoulder at a later time point. Other tools that I've utilized with this is there's something called inner balance. It's an ear lobe biofeedback unit that people can use for meditation, and it takes people's essentially their heart rate and their respiratory rate into account, and talks about getting someone into a coherent state. The coherence aligns with brain waves of alpha and beta and delta waves, but it turns it into sound, right? So if you're in good coherence, right, it chimes. If you're not in coherence, it dongs. I've only used this in the most extreme instances where people are coming in with not just physical but psychological and emotional traumas. I know you're here for your shoulder, but I'm really good at treating shoulders, but we need to treat you as a person right now because you're not in an okay position. Would you agree? And open up that dialogue. But that would be another way if you really want to objectify it. But otherwise, that's only a small cohort of my patient demographic that I see. Usually this is kind of my sequence of how I get someone into a diaphragmatic breathing and relaxed state.
All right. Moving forward, the next one